So I think we are all set to start discussions about giving the oral presentation on a very important topic related to sanitation financing. We do have some very good presenters representing multiple organizations in this conference, including from Practical Action, NGO, Forum for Public Health, and also, I believe, from academia. Overall, if I look into or if I give an overview of sanitation financing options, in Bangladesh at least, let me put Bangladesh as a country of an emerging economy. On that regard, we feel that there are certain challenges when it comes to the concept of sanitation financing. It is a blend of multiple factors which influences the decision behind sanitation financing. It also includes some of the important policies that guides the improvement of sanitation financing, or it can be detrimental when it comes to this particular option. Now, we have talked a lot about how we can engage private sector, how we can engage blended financing into the sector of sanitation. But I still believe that encompassing every financing options together is a little bit of a challenge even today. And for that, I believe our great presenters who would be talking about this important topic will be covering some critical issues when it comes to financing for sanitation. I mean, we do have multiple financing options starting from blended finance, result-based financing. There can be options of public-private initiatives or partnerships with multiple agencies. And of course, there are options of circular economy models that can improve overall sanitation framework within an emerging economy like Bangladesh. On that particular note, I believe we are all set to hear about the presentation from our great colleagues present in this room. And I would like to request our first presenter, I believe Mr. Ahasan Habib from NGO Forum for Public Health, to present his paper. Thank you. A warm welcome for him, please.
Thank you, and good afternoon, and welcome to my presentation. From Ishrat, we talked so many things, we learned so many things, mostly like in technological innovation, and then, technological innovation, and then challenge, opportunity, but there is a big issues of the financing, actually. So financing, that means it's related to the transparency, governance, and accountability. So to address these issues, we ran an experiment. It's like the impact assessment in our country. So you can see our the team. We ran this experiment. Let's say, if we see the Sustainable Development Goal data, where the safely managed sanitation is still a big question. If you want to target, achieve by 2030, it's it's quite impossible. So if we go the present data, actually. So as a part of the sanitation school what is very important because and it's contribute to the national data. So you can see some data here, like what is the scenario of our country, where internationally 50 students for one toilet, but where we had the one toilet for more than 100, and gradually it is improving. That means this type of the improvement is what is the relations with the provision of service. So either it is finance issues, or it is governance issues, or it is other the technological issues. So even particular for the schools level, wash services are morely relies on the school management committee, and the government they don't have any quite provide service or finance support, nothing else. So our motivation, particular this study, actually the corruption and the governance. Many development agencies, they studies, they find out some issues like the corruption is one of the major obstacle. Even the UNDP, they also mentioned the same, identified the same issues, like it's a major challenge, is a major obstacle to provide, to implement the service, particular for the sanitation. That's why we target to find out the address, does providing information to public with the goal of improving governance lead to better outcomes? And can transparency intervention enhance the provision of the wash services? We designed this study in two upazilas in Bangladesh, Bhola and Ramgati, which is mostly is like the hard to reach areas. We selected 60 schools, that is like the high school, with grade 6 to 10. And this 60 school is selected randomly, and based on the random selection, then we assign is like the study and control in experiment that is called like the randomized control trial experiment. And before, within the baseline and the endline survey, the local, another international NGOs, they intervene a tools which is like the annotated wash or scanning, integrated scanning tools, which is mostly like the score type of like the, it's like the scoring tools to address some like the issues, like the quality of the sanitation facilities, gender, menstrual hygiene, facilities of disabled student, and budget and expenditure. So during this intervene, so each and every school, they have some like the workshop they conducted to this participant like student, parents, teachers, school management committee representative, and local like the government representative. And we, during the, our study, we collected data, some interviews, direct observation, and administrative data from national and the school levels. And during the study, and during the observation, we used some like the motion sensor, door, magnetic door sensor for 27 hours to count the event of how many times of the toilets used by the student or others like the teachers during their school time. So let's see the result actually. So what is the impact of the like the annotated water integrated scanning tools? So actually annotated water integrated scanning tools is comprised with some like the knowledge, some behavioral practice, and some like the integrated tools. So only for the like the accountability, transparency, and participations to measure the effect. So, and they provided some like the funding allocations to see actually how they allocated this fund, how they use this fund for the improvement of their school sanitations. So after the data, we collected the data and examined, so you can see the graph. Maybe most of the cases, there is no like the very significant evidence. Some like the positive trends, but which is not very strong significant. Only like the head teachers and including also the knowledge, in terms of the knowledge, it's very strongly or just some like the significant impact, except other like teachers' knowledge, student knowledge separately. There is no like the positive even some like positive results, but not significantly or statistically significant with the intervention. Then number of, if we go to like the number of functional toilets for the student, so here like student is like the male is fine, but negatively there is no like the results. It's a negative average result for the female, as well as the same for the like the effect of the college like the effect of the college toilet index, average number of the toilet latrine use per day. All these cases are female. The female results are not like positive due to some, that there is some like the insufficient of services, insufficient of supplementary sanitation practice. That's why this is the result actually. And of course, there have some impact on the like the attendance and the results. So, but there is some impact on the attendance in the schools, but we don't find very strong or any like the positive results, particular for the student like the exams results. So overall, the like the impact of all three, like the knowledge, then use of the toilets, and the, like the attendance or exam results, we just found that knowledge and institutions, it's a positive impact. This type of the tools like accountability, transparency, and participation. But we do not find any impact that the work service and use, attendance, and exams results. So, of course, there have some like the question about the policy, because so we have so many policies, but at the root level or the local government institute, most of the cases they don't know actually what is the written in the policies. So that's the issue. So if we improve this scenario, if we improve this like the wash service or provision which is allocated by the government, of course, first they need some like the information, they need some like the knowledge about the policies, about the way of like the providing services. So that is the main questions that we identify our study. And if I draw the conclusion, actually there is some impact, because it's like the impact evaluation, like the experiment. There is some impact on the transparency intervention wash service that we find, but we do not find like any impact like there are the results or some other issues. But this intervention was conducted 11 to 12 months. So based on this the intervention time, maybe this is not the enough time, because if you measure the sustainability and the impact, at least it has some like the long run intervention due to insufficient fund or some, it's a project base. That's why we could not run another experiment for after 2 or 3 years. So actually what is there any other impact on the impact on the intervention, or what we provided the informations during the intervention, so actually how they replicate it, or is they are still they are practicing it or not. So this is all about, because it's like the 10 minutes, just I've tried to finish before my time.
Thank you, Ahasan Bhai. I do understand that the importance of the topic that you have selected covers some important issues, especially to do with the policy disconnects, which he has very aptly pointed out, and at the same time, the issues related to sanitation financing. When it comes to the transparency issue, the governance issue, there are still some void in the whole system. I thank Mr. Hassan Habib for his presentation. Request for the next presenter to come and join us at the dais. Thank you, Hassan Bhai.
Yeah,
I believe the next presenter, if he is present, Mr. Raisul Bari Shifat. Raisul, thank you for joining us. And Raisul is represents as a water resource engineer from Esolve, which is an international firm focusing on multiple service delivery options related to water and sanitation. I request him to give his presentation. Thank you.
Okay, thank you. Am I audible?
Yes.
I think. Okay, so I'm Raisul Bari Shifat. I'm representing my organization, Esolve International Limited. So we are working in the sewer network designing, FSM related studies, and also we are doing hydrological studies. So yeah, I'll just get right into my presentation because I have a 10 minutes limit. Okay, so these are my fellow co-authors in this study. So we are working on the sewer expansion effects on sanitation in Chowdhury city. So let's go. So we already know, we already been in this program for like last 2 days. We already know about all this stuff, about these things. We are focusing on 6.2. We already know about this, so I'm not going to go in detail about these elements. So this is our study area. So it's Chowdhury City Corporation, and as you can see in the map, in the first is from the S3, the land use pattern of Chowdhury City, and you can see there are like most of these areas are built areas, and with some hilly areas and some crop vegetation and croplands related to it. And one side of this city corporation we have Bay of Bengal, and the other side we have the Karnataka River, which comes from the many descent of our upstream rivers. So the current sanitation condition in Chattogram city, as you can see from our BBS 2022 data, we have around 76% of tap water supply and 21% of like on-site water supply, which is extracted from groundwaters, and have bottled water for 1.96%. And but the sanitation system, it doesn't have any centralized system. So we have the centralized water supply system for like 76%, but there's no centralized sanitation network. But in 2017, the government have taken initiative, and Chittagong Siwasa Master Plan have initiated a 6 sewer network project in Chattogram city, and divided into 6 catchment. So you can see the details of the catchments are here. So there are 6 catchments, and also you can see in the rightly 3 bullet points, there are 2 fecal sludge treatment plants. So our focus in this study is to assess if the centralized sewer network are enough for the city, and how much sewage will remain at on-site to collect. So this is, we have taken comprehensive framework which calculates the ward-wise spatial data and the yearly, 5-yearly temporal data for this calculation. So this is an official document from Siwasa. You can see the 6 catchments, the networks, the initial potential network layout, and the STP sites, the boxes you can see. Okay, and so you can already see some gaps in the network. We'll be discussing about the gaps mostly in this presentation. So our assumption is, we have some assumptions. First, this is informed assumption is the completion target, the commissioning target for the 6 sewer network will be 2045. And you can see a peculiar order, 1, 5, 6, 3, 2, 4. So this is what we gathered from the open source documents, that which one is at what stage of this, the conceiving of the stage of these STPs. So you can see 1, then bracket 2, 5, and 6, and 3, then 2 and 4. So these are, we assume that each one of this stage will complete it by 5 years. So the first STP is aimed to be completed in 2030. The next stage will be 2035, and then next 40 and 45. And we also have taken another assumption that 100-meter buffer zone from the sewer network will be connected the households and everything. Okay. So this is a boring slide, I must say. So you can see also my formatting is little bit off. So this is our framework, like full study. We found, we have collected the available data, publicly available data. We analyzed those data in GIS softwares and like others methods, and then we made some interpretation and then the results. So a more visual methodology will be this. So as you can see, the first map, you can see the city corporation effective area. The most of the population are living in those effective areas. Also the boundary of city corporation and the potential sewer network layout and the coverage, the 100-meter buffer zone from the networks here. So the final and the biggest map you can see is the map which represents the area which are not connected in effective areas, which are not under sewage connection. So so that was the spatial part of this study. Now if we go to the temporal part of the study, so we did the population projection for each ward separately. So we used 2001, 2010, and 2020 BBS data and projected by geometric growth method. We also considered the land use pattern from the open source satellite data, and we also calculate the density of the population from the effective area designation. So every item of this calculation is dynamic. So for each ward, the effective area is changing, and every 5 years, the population density is changing, so everything is moving. So you see the little bit of animation here. So our target year is 2070. You can see the one wards, wards 38. Maybe here you can see properly the most dark one that have the most density in terms of population. So this is our timeline for our sludge volume estimation for each ward. So this is our timeline. This is 2030's map. You can see the most sludge is generated in Ward 39 and after the completion of STP1. So as the year goes by, in every 5 years, as we assumed some of the STP will be commissioned by then. So when you see 2035, you see some lighter, some colors getting lighter and some are getting darker. So the lighter ones means that those areas are connected now with the STPs. Okay, so in 2035, we have 5 and 6 connected. And then the next year, we can see the 3 is connected, and then the last is at 2 and 4. So this is the optimum year. 2045 is the optimum year for the sludge to be generated. I think the minimum amount of sludge is not collected. After that, it just goes on and on. So you can see the dark. So you can see 2 wards, 2 and 4. So why they are not? Why they are not like have the most sludge generated is not connected by the centralized sewage system, because those areas have hilly terrain, hard to reach areas, narrow roads and everything. So there is no potential sewer line there. So there's not a lot of sewage sludge is collected from those wards, right? So okay. So key findings and outcomes. So these are the key findings. The CWASA requires a parallel sanitation system for the city to collect the remaining sludge from here. And also, this study is mostly effective for CWASA to understand how much logistic support they will need to conduct this operation, how the business model will be, if any third party is involved in the emptying service or the FSTP operations. So these are our findings, and we are also we also hope that CWASA will produce the policies and guidelines to regulate the operation and maintenance for these projects. So thank you. That was just all. And lastly, I want to mention some limitation. I have 40 seconds, I think I have. So our limitation that we are presenting here, we have 12 slide limitation and 10 minutes of timely, I think, limitation. And so I think there's a lot can be discussed maybe in an hour session about this topic. Thank you.
Thank you, Shifat. That was a very well thought out presentation. I would again reach out to the audience if there are any questions. At the back, please.
Thank you, Shifat. I mean, that was an excellent, an eye-opening kind of, study. So roughly, I mean, currently and as of when the project will be completed, what percentage of population will be covered by this sewerage network?
So it's estimated 40%, but the actual scenario, so when the we are working with the tender stage data, right? So when we'll use the more, in the construction period, like now the STP1's construction is going on. So we know the network is like spreading more. So as that estimate, it will be 60% coverage in 2045. But as per the tender documents, our study is 40%. So 60% will be remaining in on-site.
If you could introduce yourself along with the question. Thank you.
Yes, sorry. My name is Antoinette Komen. I'm with SNV. My question is just about your idea for the unserved areas, which, or in future, yes, which you say are hilly, inaccessible, small roads, etc.
Yes.
Yeah. Is emptying and transport there the only option? Or is there an option of, let's say, alternating twin pits? Did you look at alternative options? Because it seems that if the transport and roads are so complicated, then sludge management is going to be pretty complicated.
Yeah. This is actually a part of the decision makers part. So what I can tell, yes, we have assessed the biofuel toilets options and the two-pit solution options, but the CWASA's plan is to build a two major fecal sludge treatment plant, and they don't want those plants to be wasted, right? So they want to use them. So my study is focused on like how to optimize those use, and also how there is some issues like the hilly terrain. There is a head loss issue when you are collecting the sewage. So we are actually facing those difficulties. We have to solve them. It's not like we are assessing a different option. We are assigned to solve those problems, which will be connected to emptying those hard-to-reach areas. Right.
Do we have time
Yes,
for
yes.
one?
Maybe one last question, Rajiv. Yes.
Rajiv, SNV. Just a follow-up, like, I mean, it's quite good to the model you have developed.
Yes.
So based on that, as you responded to Khairul Bhai's question, like 60% would still be unserved. And in that case, there will be 6 STPs and 2 FSTP.
Yes.
But is there provision of small decentralized system in terms of costing analysis, and also in terms of per capita investment of 40%, 60%? I mean, has anyone done study in, because in Chattogram it's going to be the first sewer network in terms of investment. I know like WUSUP was working, WUSUP and WaterAid was also working in Chattogram earlier on non-sewage sanitation.
So yeah, we are actually the organization working on the storage unit. It's like from designing the networks and also the decentralized systems, assessing the decentralized systems. So what our thought about this, like not connected area, you can see the many gaps. So there are reasons like those areas are not urbanized enough, and hilly areas, it's not like one. So they have, CWASA have provision of keeping those as a non-priority area for now in the phase 1 of this sewage system design. So in the future, they will connect those. So there are outlets for those inflows of non-priority area. So even if you see there are some areas, large areas not connected, it may be the non-priority areas, which will be maybe tender later, and this will be design later. But there are also outfall location is set up to the priority areas. So if those areas are connected, I think this will reduce a lot. Yeah.
Program Development Authorities planning?
As of today, no. But I can tell you unofficially, it's on the process, that they will be included in this, in the whole process, the city corporation. Because currently, the city corporation is actually seeing the dislodging. They have some dislodging mechanism and whatnot. Right? Yes. Right.
Not the city corporation.
The CDA. Yes, I know. The CDA, city corporation, and COS are the largest development authorities. So there's a process currently ongoing. I can't say anything official because I'm not from the government. So there's something going on, and maybe future they will create an integrated body to operation and maintenance these systems. Okay.
Thank you, Raisul. I think he deserves a clap for his presentation. Thank you so much. But he has definitely opened a very important topic of who pays for this, and what are the social and economic costs related to it, and how it should be financed. These are all critical questions. I think we are optimally lined up for the next presentation from Ms. Ishrat Shabnam, who is the Country Director of Practical Action in Bangladesh. And she manages a multiple portfolio, including working in the sanitation sector. Ishrat, over to you. Thank you.
Hi, everyone. Good afternoon. Good to see many known faces from the sector. I am Ishrat Shabnam, serving Practical Action as Country Director. So one of the 4 themes Practical Action work on is urban sanitation. So my presentation will be focusing on public, private, and local to national perspectives on strengthening the FSM leadership. So in this room, we have many faces, many thoughts, many brains. We may differ on many points, but I think we have one common idea or common passion, and we feel the urgency that there is much effort needed for achieving SDG 6.2 and 6.3. Referring to 6.2 is having universal access for urban sanitation, and at the same time 6.3 for a reduction of 50% water that is reaching to the environment untreated. If we look at the overall leadership or the discourse of the leadership within the sector or within different discourse of the development sector, we see that for producing any change, actually the key role is played by the leadership rather than management. If we would like to divide it, so 80% leadership and 20% management actually plays the overall crucial role in bringing in that change. Now, for a sector which is complex enough, like sanitation, urban sanitation, we have many ideas around. We have spoken a lot of areas altogether. For example, infrastructure needs, financing needs, JETZ, as well as how we can bring in the nexus discussion in it. We have seen that complex problems and rapidly changing solutions require more leadership from everyone, from every stakeholder we talk about. And these skills may be appropriate for some, but now it's very important that these leadership roles becomes as a necessity. Now, to put the thought in a more structured way, we have tried to put a base on it. So what is the base? The base is from a study which has been done by Andrew Taylor. Andrew Taylor is a water sector leadership expert who has actually structured the overall style and era of leadership into 6 different categories, where we see champion leaders, enabling leaders, cross-boundary leaders, thought leaders, strategic leaders, and trusted advisors. So our overall intention through this study was to look at the urban sanitation sector and actually put a lens into each of the leadership category and see which role is needed for what need. To look to take a deeper dive into the leadership styles. So we speak about champion leaders. Who are the champion leaders, basically? So the champion leaders are the early adopters who can actually take risk. If I would like to give an example, I would say that we can think of a mayor who can actually risk negative feedback, risk his reputation by taking decisions for disconnecting illegal drainage connections, or maybe speaking upright for better sanitation, for following building codes for the residents within his territory. So they can be considered as champion leaders. Then comes the enabling leaders, who they can be. From the government side, the top and middle management can be really considered as enabling leaders because the enabling function is more into their hands. They regulate. They can bring in policies. They can bring in the thought of transformative change through the policies as well as monitoring of the implementation. Moving on, cross-boundary leadership is such that which can go beyond geographic boundaries, which can go beyond particular discipline, which can be multidisciplinary. At the same time, it can be functionally segmented as well. Here, one complexity also arises because when it's multidisciplinary, the team members will be coming from diverse sections of the sector. So their leadership can be complex. Why? Because you have to influence team members from different sectors. And here, most of the times we have seen that rather than imposing power, it can be more easier to maneuver when the leaders have the personal influencing skill. Coming to the thought leaders, they are those who can actually bring in ideas, generate ideas, and promote these new ideas among the stakeholders who are in the places of decision making or are in the cross-boundary leaders. Just moving back to the cross-boundary leaders, I would like to also give one example of public-private partnership in a municipality where there can be private desludgers, then there can be access to finance through banks, municipality officials, at the same time cooperatives of the sanitation workers. They all together bring in the leadership of the cross-boundary aspect. Moving on, the strategic leaders are those who actually have the authority to implement change, bringing in shared understanding among all the stakeholders. Here, one example can be the CVS FSM cell at the DPHE. So they have they are rightly placed, and they can bring in other stakeholders amongst us, and they can bring in the shared understanding to implement change and bring in new ideas to actually implement those changes. Trusted advisors are very interesting. They can actually create a catalytic role. We can think of retired secretaries from the government or the high officials who has already spoken the language of the government, and they have already realized the policy needs, policy gaps. And once they retire, then their capacity can be utilized in the bilateral development partners discussion, or probably in the overall development discourse. And they can actually drive the political will using their influence on the overall government and the political dynamics. Moving on, leadership styles in Bangladesh FSM system. We have also tried to look into who can play which role appropriately, or who have been playing which role so far in that way. So the champion leaders can be the NGOs, just like, I mean, it's not an exhaustive list, but for example, Practical Action, WaterAid, USAP, SNV, and many more. But what we see is FSM champions are not very much evident in the city level. So it's a little bit, we have a lack, and we need to work more towards that. Enabling leaders, we have very evident, prominent Bill and Melinda Gates Foundation, who have really given us the overall champion leaders. They have created a space for us for experimentation and also collaboration. But having Bill and Melinda Gates Foundation taking a shift from the region, we see an enabling or emerging lack in this sector as well. So we need to quickly explore who can be the next enabling leader in the sector. Coming to the cross-boundary leader in Bangladesh, it's really difficult to actually identify who can play or who have already played the cross-boundary leaders. Thought leaders, ITN, BUET we have, and also there are many other academic institutions who can actually be thought about for thought leaders. They have been serving the community, serving the sector with their new ideas, and bringing on the table these academic discussion. Now coming to the strategic leaders, basically I have already mentioned the CVS FSM support cell and DPHE could play that role, but strategic FSM leaders in Bangladesh are quite missing in the most of the municipalities. Trusted advisors, as I have already given the example, what we have seen is there is not many or very rare in the sector who can actually recognized as trusted advisor and who we can really rely on. Our idea is that there may be existing, but we have not been able to pull them in the ecosystem so far and made the most utilization of their wit and their resources. As a conclusion, I have to highlight that so far where we have reached up to is the result of effective leadership, be it Gates Foundation, be it the leaders we are talking about. They have brought FSM into a point where we are, it's in the forefront because of this effective leadership. But now we have to think on how thematically, multidisciplinary, in a multidisciplinary way, how we can put FSM leadership stronger and more concerted, more confident. So especially leadership styles of enabling leaders, cross-boundary leaders and trusted advisors, we still have to look for, bring in, and actually absorb them in the ecosystem for leading us further. Finally, we do not have we have not much invested into leadership development so far. Had we done it earlier, we may already have certain enabling leaders, cross-boundary leaders, and trusted advisors. So still we are not late. We can still think of investing further for leadership development, leadership capacity development in the sector, so that we can actually move towards the achievement of 6.2, 6.3, and many more. There I rest my presentation. Thank you all.
Thank you.
Is it working or do you want to use this one?
I'm good. Thank you, Ishrat, for the wonderful reflection on how leadership can shape the pathway of sanitation and overall the governance issues of it. I'm sure there could be some questions from the audience. If there are, I would love to have them, and Ishrat would be responding to that. We have one here, please. Two, actually. Please mention your name along with the question.
This is me, Tirtha Karmakar. I am from Esolve Limited. That was an insightful presentation. Thank you. So my question is it possible to have multiple category of leaderships in a specific area at the same time? And if there is any, so, and if we make a flow chart of hierarchy or organogram, who will be on the top? Thank you.
Thank you for the question. This is actually a very interesting exercise which we also tried to do while doing this study. And what we realized is sometimes the leadership roles flow between each other as well. So some leadership categories may need to be present in the earlier stage of the discourse. Some may need at the end. For example, when the system or implementation is already at par, then maybe the trusted advisors can play their role, really, that the sector is ready now, and now much implementation is needed. So, but it's free-flowing sometime. The hierarchy would be really difficult because strategic, enabler, champion, so we can rarely strictly categorize them into different ones. But we would definitely like to see these qualities in the leaders who are leading the discourse right now. Thank you.
Hello. Ishrat, very good afternoon. And as I know that practical action is working in practical locations and diversified areas of Bangladesh. Just my question is that in this presentation, I was just thinking, or before that, I'm just saying my name. My name is Abir. I'm from SNV. Just one, that can be a call to action or a question maybe. Apa, you are saying that the FSM leadership needs a blend of expertise, a blend of technical collaboration, and different things like that. And we are seeing that like universities like Monash, universities like Princeton, Cambridge, they are offering such leadership courses which are online, and we can really take part in it. Do you think that the conveners we are working over here, can we think of something like that, which in SNV had promoted in Khulna City Corporation, and Kuwait is like having a long course on master's course of sanitation as an impact of that. So can we like rethink about some course in some universities or with collaboration with some academia and other actors, so that at least we are talking about leaders in theories, then we can bring them to in practical scenarios as
Absolutely. Well. That's the key aim of this study. Because if you look at my last line, so we need more investment. So all these courses for the participants, we need some investment. So whenever we design project, probably if we put it in a very practical term, we should also be keeping in mind that we need leaders, and that should emerge from the process itself. It cannot be standalone exercise that may not be funded by that may not be very lucrative for funding for the agencies, but if it is embedded, connecting with the need itself, it would be more meaningful. But it's much needed. Thank you.
One more question.
Thank you for the excellent presentation. I was looking to the terminology of the whole presentation, that FSM leadership. There are many actors and organizations involved in the whole process. I am being one of the implementers, and one of my colleagues is also from Khulna is there. I am from Sylhet. I am Chief Waste Management Officer of Sylhet City Corporation. Then I was looking that where am I fitting, in this whole process. I don't find myself there. So I think I will request you that you put ourselves also there, because we got to implement that, how I am going to be benefited in the whole process. This is one. And I'll term it more of a management thing rather than leadership, because enablers, then facilitators, advisor, all those things are in a management-oriented thing rather than a leadership. It's my personal opinion. You can comment on that. Thank you.
Thank you. Because it has been the purview or the background has been practical actions overall work so far, which is why it's FSM. And as a secretariat of FSM network, it has been put like that. But definitely, a role is befitting because, as you have mentioned, that your role, because we are talking about the municipalities, we are talking about the municipality officials and also government entities who are working at the policy level, implementation level, definitely. But on the point of leadership versus management, it depends. You can manage only when there is a leader, and when the leader, either the leading agency is raising it, then it's laid out, then the management comes in. So there can be different opinions. I have already mentioned in the beginning that we have many brains, many opinions. We might differ in many as well. Thank you.
Thank you, Ishrat. A warm welcome to our next presenter. But before that, put your hands together for Ishrat as well. Thank you. Our next presenter is from Dhaka Medical College, Mr. Abdullah Al Maruf. Yes, Mr. Maruf, if you could please come up to the dais. Thank you.
Good afternoon, everyone. I am Abdullah Al Maruf. I'm a final year medical student from Dhaka Medical College. Today, I am honored to present our study titled The Toll of Toilet Evidence on Female Medical Students. Toilet evidence among female medical students has grown as a significant concern due to its implication that extend beyond mere convenience. This phenomenon during academic settings and clinical rotation is influenced by the complex interplay of curricular burden, socio-cognitive, environmental, and physiological factors. These issues in women remain largely overlooked in low and middle income countries like Bangladesh, where healthcare infrastructure is very much fragile. Through our study, we will try to explore the prevalence, associated factors, reasons behind toilet evidence, behavioral patterns, and health implication of toilet evidence among female medical students. An epidemiological cross-sectional study was conducted among 206 female medical students across different academic years from 10 different government medical colleges. Data were collected through face-to-face interviews, phone calls, using a structured questionnaire focusing on toilet usage frequency, reasons for avoidance, self-reported health outcomes. Likert scale was used to evaluate the impact of factors. Chi-square test was used to analyze the associations. Among 206 participants, 201 participants reported toilet evidence ranging from 1 hour to more than 6 hours. Common reasons are perceived lack of cleanliness and fear of contracting infection, indicating environmental and socio-cognitive influences. Discomfort or pain and difficulty concentrating were observed as the immediate complications. Among the delayed complications, UTI, digestive problems, and anxiety were observed mostly. Besides that, 48.79% of individuals reported intentional reduction of water intake to further avoid toilet uses, which further led them to dehydration. A significant relationship was found between the year of study and reported difficulty concentrating, with fifth-year students reporting the highest levels. Cleanliness concerns were strongly associated with both stress and difficulty concentrating. Moreover, 83 individuals reported toilet avoidance has affected their academic performances. This study recommends adoption of women-only toilet with improved facilities, sanitation, changing facilities, disposal facilities, flexible scheduling, which allows for regular breaks, arrangement of awareness and education programs that address these issues, establishment of social support group or counseling service, which will discuss their experience and will help them further. By implementing these recommendations, a supportive educational environment can be created, which will further elevate their academic performance and make them the best doctors of this country. Thank you all for your patience hearing.
Thank you, Dr. Maruf. One question that I have before I go to the audience, it seems to me that your study was conducted among students who perceived public or communal toilets as unclean. Am I correct? Is it public toilets? Right. Or is it their own personal toilet? What kind of toilet are you? The public toilets, yes. Or communal toilets? In the academic city. Okay. So, so that is a clarification that I needed. So I now would like to go back into the audience and hear if there are any questions. There is one, please, here.
Okay, I'm Tareq Mahmud from Jahangirnagar University. So I saw that you have collected data from 206 students. So my question is, what was the sampling method you used for computing the number of participants? And you find that fifth-year students are avoiding toilet the most. So what is the reason behind this? So thank you.
Okay. The fifth-year students reporting mostly because fifth-year student has to undergo both clinical rotations and academic settings. They have to stay in lectures and also in wards for more than 12 to 10 hours with rigid routines. So that's why they are facing more difficulties. On sampling method, we collected data from 10 different government medical colleges using face-to-face interviews and through phone calls using a structured questionnaire. Also, Likert scale was used to see the impact scores. Shieskar test was used to see the associations.
Thank you so much. I mean, I'm really delighted that being a medical student, I mean, not yet a doctor, I mean, you had put forward and came up to present in such an august gathering. I mean, congratulations. And
thank you, sir.
I really appreciate it. So I was thinking, I mean, I'm not going to ask you about this study or anything. I mean, I understand because long ago I studied in a similar medical college. So why didn't you approach the principal or hospital director that our toilet needs to be clean? What refrained you from taking any action?
We are talking to directors for hospital issues, also principals, but we have lack of space mainly, and we are also undergoing some reformations, infrastructural reformations. Hope that that will solve that case. We also recommended women-only toilets, not mixed toilets.
Thank you. This is Abir again from SNV. I am questioning you because my sister is a doctor herself, and it was like pinching in my head whenever I was seeing in this presentation, that how much maybe she might be going under this. So I'm questioning you that, direct question, sir, to you, that do you think whether any NGO or whether any corporate sector or any private sector can help you or can support you, as there are like we all of us know about in Bangladeshi public institutions and the methodology of work and the speed of the work of those. We are trying to like improve those. But do you think that NGOs or INGOs or any type of partners who can be like involved with you, or suppose we design a project like this that for the medical students we need to see, and we can attach corporates, attach corporations and other bodies, so that the toilets can be maintained regularly, they can be cleaned regularly. Our girls, our sisters, our like acquaintance, everybody can feel safe that we are studying about hygiene, studying about everything of human body, but we are not actually maintaining this. So, do you have any recommendations on this?
Yeah, but there are some limitations. We can, though these are the government colleges, authoritarian permissions are needed. We can talk to our principals regarding this. If any collaboration needed, through the authoritarian body, it will be conducted. We can suggest only.
But do you recommend it?
Yes, obviously. You are all welcome. Welcome.
Thank you. Thank you, Maruf. That was a very insightful presentation, and I'm pretty sure that the scenario that he has presented is similar not only in medical colleges, but also in multiple educational institutes across the country. It is very common for girls to avoid going to toilets, mainly because of cleanliness issues, but sometimes since we are all here together, I think we also need to talk about some serious issues related to menstrual hygiene management, which is often not taken seriously enough, especially when the leadership are men. So that is one issue that we also perhaps should be taken into consideration, but thank you for the insightful presentation. So moving on, I believe the next presenter is Tareq Mahmud from Jahangirnagar University. Over to you, Tareq.
Thank you. So I'm Tareq Mahmud. I have completed a Bachelor of Public Health from Department of Public Health and Informatics, Jahangirnagar University. And currently I'm a student of MPH. So I will present today about the disparities in access to improved sanitation in Bangladesh. So we know that there are a lot of disparities. We have conducted studies with secondary data. So why we conducted these studies? Because sanitation is a major public health concern. So you know that each year 340,000 children under 5 die from the diarrheal disease due to sanitation related cause. Globally, near 4.5 billion people lack access to safe sanitation facilities. So that is urgent need for improved infrastructure and policies, and poor sanitation contributes to malnutrition, stunt growth, and increased healthcare cost. So there are a lot of things that we should improve the sanitation. And you all know that we are talking we are talking again and again that about the SDG 6.2. So that is improved sanitation is our goal for SDG. So what is the objective of our study? So we find out the prevalence of improved sanitation in Bangladesh, assess the urban-rural disparities. There are a lot of disparities category. So urban-rural disparities is one of them. Identify the key factors influencing sanitation access. That means what are the factors that influencing the disparities. So then analyze the impact of water access and hygiene practice in sanitation improvement, and evaluate regional variations. So in 8 divisions of Bangladesh, there are disparities, and we find out the disparities. Then the study method. Study method was we use secondary data. from Bangladesh Demographic Health Survey. That health survey was conducted, and the authority is USAID and Newport. We use the latest BDHS data, that is 2022 Bangladesh Demographic Health Survey data. So we classified the sanitation, classified the type of sanitation, that's improved and unimproved. So according to the toilet type and is the sanitation is shared or not. And we use the statistical analysis like chi-square test and binary logistic regression to assess the significance and assess the factors. So we use SPSS software 27 version for showing the significance. So what is the result? So you see that according to the 2022 data, 60.5% people have the improved sanitation, and the rest of the people has unimproved sanitation facilities. So the data was from a sample. You see that the total household analyzed was 29,640. So among the household, 17,925 household has improved sanitation. And the rural and urban disparities, you see that 63% urban household has improved sanitation, and the other side 58%, though the disparities is small, but it has showed the statistical significance. And the influencing factor was geographical division, household size, age and education of household head, and water access and hygiene practice. So go to the next slide. Regional sanitation facility. So can you think that we all think that Dhaka Dhaka has higher facilities, or Dhaka has much more facilities, but you see that Borishal division for rural area, Borishal division has, you can see in orange color, that is improved sanitation, the percentage of improved sanitation. For rural area, the Borishal division has the much number or much percentage of improved sanitation. You can see that the for urban area, regional sanitation facility it is also for Borishal and Rajshahi. Borishal and Rajshahi has higher percentage of improved sanitation. So you can see the number for binary logistic regression. I can say that Dhaka has 3.75 times less likely to have improved sanitation than Sylhet. So you can see that the disparities and wealth disparity. So we are talking about that. We can assume that the richest person from both area, both rural and urban area, has the highest percentage of improved sanitation, and you can see that the poorest, people has less improved sanitation facilities. So the number is 25.6 times less likely to have improved sanitation than the richest. The poorest person has 25.6 times less likely to have improved sanitation. So you can see that disparities among the people. And if we want to discuss about our result, BDHS data that was in 2017 and 18 study, only according to that data, only 44% of household has improved sanitation. Then the percentage is increased, and we saw that now according to the 2022 data, so 16.5% have the improved sanitation. So but the urban and rural disparities persist. And what we need? So we need increased awareness and education in rural communities contribute to the improvement to mitigate the disparities. So what is the conclusion? and what is our recommendation? So we can conclude that the significant improvement in sanitation practices, you NGOs are working on that, WaterAid is working on that, and the government of Bangladesh is working on that sanitation, improving the sanitation practices. So there is disparities for wealth index. You can see that the poorest persons are not using the improved sanitation facilities. And you can see the disparities in Dhaka. So when we were analyzing the data, we saw that, oh, how that is possible? Dhaka has much more facilities than other divisions. So why Dhaka is more likely the victim of this unimproved sanitation? So we thought that Dhaka has much number of slum. So that slum area has not much more improved sanitation. So we see that the disparities remain on the region, oil status, water access, and hygiene practices. So we should go for targeted intervention in underserved region. We should find out the regions. You NGOs can work on that. Which regions of Dhaka are the victim of this unimproved sanitation. So we can reach that area and improve the sanitation quality. So improve water and hygiene infrastructure. So we have to improve the infrastructure, enhance the public awareness. You guys already are working on that. So we should increase the awareness. Strengthen the policies and investment for equitable sanitation access. So we have also policies that, and we can. I think there is a system to monitor the sanitation. What are the current situation of scenario? So I think strengthening policy and investment can improve the picture. So that is from me. Thank you everyone for listening. Thank you. So if you have any question.
There is one question over there. Thank you, Tareq.
Excellent presentation, especially I like the last slide. However, yesterday we talked about safely managed sanitation. But in your presentation you have mentioned improved sanitation. Can you define this terminology, please? Thank you.
So we have classified the sanitation in two categories, that is improved and unimproved. So improved sanitation, we have classified that based on the data, the household using the type of toilet, or are they using the shared facilities, or they have own toilet or own sanitation facilities. So we have classified the sanitation as improved and unimproved. It is safely managed. Improved means that is safely managed.
Okay, I do believe that there are certain conceptual understanding that we need to generate, but this is a good start that our younger youth is thinking about these critical issues. Again, if there are any questions from the audience? If not, I just want to reflect on a very important topic that Tareq has brought up. It is the out-of-pocket expenditure when it comes to WASH, right? When we conducted the National WASH Survey in 2020, we noted the disparity was quite clear. The urban investment, the out-of-pocket investment in WASH was much lower compared to that in the rural area. But when you take into account the overall household income, percentage-wise, it is much higher in the rural areas. So that's where the disparity is spreading a lot, and the gap is increasing. So the reason for that are multiple. It can be related to the average household income. It can be related to the overall public health condition in that particular locality, how it is impacting people's health. And at the same time, it also takes into account the governance features that guides the progress of water and sanitation and hygiene in a particular locality. On that note, thank you so much, Tareq, for your wonderful presentation. A warm greetings for him. And we are slightly behind time, but I believe we have reached the last presenter for the group, Ms. Khadiza Tul-Coubra, who is presenting on behalf of SNV.
Good afternoon, ladies and gentlemen. I'm pleased and honored to have here present our research work. First of all, I am not a behavior change communication expert, but I am learning it. So this study has been undertaken for SNV Bangladesh for the project demonstration of pro-poor market-based solution for fecal-sludge management in urban centers of southern Bangladesh. Finally, I would like to acknowledge the supervisory role, Mr. Rajiv Munankami, team leader of the FSM program, and Ms. Antoinette Combe, Global Sector Coordinator of SNV Netherlands Development Organization. Also grateful to all of my colleagues who supported me much to make this work significant. So let's have a glimpse of our research. Do we know what is behavior change communication? Do we know why it is important? Can we hands on? Okay. Behavior change communication is a strategic approach that uses tailored messages and engagement to influence positive behaviors in communities. So I am just representing two sentences. You can think about this sentence within my presentation. Is it behavior or is it habit? I drank a glass of water and I long for peace in the world. Okay, now I am going to my research. So over 60% of urban households lack access to safe fecal-sludge management, leading to severe public health. So this study examines how consumer behaviors influence fecal-sludge management adoption and explore barriers and motivators that shape sanitation practices. Here is our research objectives. We actually tried to identify barriers and drivers influencing fecal-sludge management and tried to understand how behavior change communication affects fecal-sludge management adoption and assess the role of gender, social norms, and affordability in sanitation decision making. When we went through this research, we focused on three basic questions. First one, why do people delay sludge removal until it becomes an emergency? What motivates or discourages households from adopting twin-pit toilets? How do social norms and economic factors shape fecal-sludge management behavior? So here is our theoretical framework. We used Sanifoam model. So the study utilized the Sanifoam framework for sanitation behavior change as a starting point for the inquiry into the factors that affect the adoption or non-adoption of the three target behaviors. The Sanifoam sanitation behavior change framework has been developed specifically to assist in the analysis of sanitation-related behaviors and design of interventions to promote the adoption of such behaviors. Sanifoam identifies a number of specific behavioral determinants may affect an individual or a household opportunity, ability, or motivation to adopt a given behavior. We can just take a view for our overall fecal-sludge management value chain, where private sector is engaged, public sector is engaged, and where the unbundled things is present. So here is our methodology. This study conducted in 3 locations, Kushtia, Jhinada, and Khulna City Corporation. So we actually went for this research to qualitative research, focus group discussion, in-depth interview. So overall, our participants was male and female. Here is the number. And we also have the analysis of thematic coding based on behavioral pattern. Here is some behavior change communication activities we have done according to this research. And here is our key findings. We have three basic behavior. First one is safe and regular sludge removal. Second is installation and use of twin pit toilets. And another one is maintaining water seals. So when we went through the findings, we find that for behavior A, we had a probability to delayed action until speeds overflow, performance for manual service due to cost and availability. Another one focused is low adoption due to space constraints, financial barriers, and stigma around the reuse of fecal sludge. For the third behavior, we need to quick fixes for broken seals, driven by social pressure. Awareness exists, but health implications are unclear. We got some barriers also. When we focused our three main behavior, in that time we find that the high cost, limited awareness of mechanical service, logistical challenges for mechanical access, space limitation, competing priorities, lack of awareness about benefits of twin piece system, shared latrine responsibilities unclear, limited willingness to spend on non-emergency repairs. Finally, we have some drivers also, like when we are managing fecal sludge management, we have some motivation, like we have 15 universal motives to do any kind of work in behavior change. So when a people is managing fecal sludge, they sometimes feel disgust, convenience, and improved awareness through campaigns. Another thing is durability, social status, which is also associated with high quality latrines. Another one is child health and social reputation as primary motivators. So, to make this research significant, we had already done with the effectiveness of the study. So here is our graph where we noticed that community meetings were identified as the most effective messaging medium with a higher impact among indirect participants. Purushabha ranked second, while mobile SMS was noted by 15% of respondents as a key channel for reaching house owners. And here is the graph for what kind of messages need to be delivered to the house owners. So most respondents, 59% were unaware about the details of Purushabha's Vacutek services, cost, location, and service timeline. Among directly participated groups, 77% identified service information as their primary need compared to 54% of indirect participants and 58% of non-participants. When we went for the surveys, we found that 67% of households who participated in the campaign had emptied their septic tank or pit within the last 1 year, which is much higher than the baseline condition, 56%. The ratio is also much higher compared to others who indirectly participated, 35%, or not participated the event. So among these three graphs, I want to highlight that in Jhinaida context, people are too much connected to their neighbors, to their relatives, that they are not engaging directly in the participants, but they receive their messages. So it was very interesting findings. Here is our recommendation. So in this phase, I highlight one recommendation. People who are actually working for sanitation field with municipalities and Purushabha, so we need to take initiative to launch or to sustain behavior change communication. We need to go forward institutionalization of behavior change. That will be sustained model. If we want to take any kind of action, then it will go smoother. After ending my presentation, I will try to read some quote which I got from our research findings. Women from Khulna, because I have a latrine, my daughter has higher marriage prospects. From Jhinaida, if the people in the Purushabha go for strict enforcement of law related to emptying of pets, then it would work. Educated people and health workers from NGOs can make people understand about this. Many will listen to them. From the Khulna City Corporation Councillor, the Vacuum we have now cannot go through every road. We have proposed changing the size and design of the vehicles. If the religious leaders and other respectable figures say it strictly that pits should be emptied before they fill up, then it can influence behavior. Everyone in the community thinks that pits should be emptied before they fill up, and that it should be done in a way that does not cause inconvenience to others. Thank you. And one more thing, that SNV is strongly working in behavior change communication, so many more are coming. Stay tuned with us. Thank you so much.
Thank you so much, Khadija. I believe that it does open an option for a lot of questions from the audience. Habib Bhai, I see Habib Bhai over there at the back.
Thank you, the good presentation.
Thank you.
There are a lot of information there, but just I'm wondering to know one thing, that at community level, so before that, you mentioned in here that the meeting with the community level is the best effective tools for communicating with others. No? The
context of Jhinaida.
Context of Jhinaida, that's fine. But it is derived from our experience that you will find there's some, the local level, in particularly the low-income community areas, you will find some local pharmaceutical shops. Yes. So they play a kind of influential role to those people that, this medicine can, like a doctor, they can just, influence the people. So you can take this medicine. So medicine is a dangerous thing even, but they can influence. But I'm wondering to know, do you think those influential people, can play a role to disseminate a kind of message and influence the community people to undertake this kind of hygienic service, fecal sludge management service?
Yes, thank you so much. Now we are working in a sustainable urban water cycle project, and in this project we are doing for specific community, for specific people, for specific message, specific emotion, specific motivation, specific behaviors, barriers. So when we try to through our message, of course, we will highlight, we will focus on our audience, our community. If you observed our quote, then I mentioned one that religious people can influence others people in a very greater way. So, of course, when they will take lead and we will engage with them, then it will be more greater. Thank you.
There's one question at the back, please. Thank you. There is one. So we will come back to you.
So the question is that as BCC is a kind of a new approach, it requires dynamic strategies at the field level to be implemented. So could you please highlight the fact that how young generation as one of the key stakeholders of a community can be integrated into this approach? And also if, as you say, that SNB has been implemented this at the field level. So could you please give any example of integrating youth in this process? Thank you.
Yes, of course. I already told that we have a plan for every specific area and every specific community people. So they have also age range, they have also different kind of occupation, wealth index. So different kinds of things. So if we focused on the youth, then of course we will try to integrate together. Thank you.
There was one question from you, please.
Hello, thank you. This is Tirtha again from Esolve. So that was a nice presentation.
Thank you.
So my question is, I have two questions actually. The first one is you have adopted foam method, right?
Yes.
So what is the main reason for utilizing that methodology? That was my first question. And the second one is you have shown some quotes at the very last of your presentation, right? So are you generalizing the overall situation based on those quotes, or can it be biased if we consider those quotes from particular persons from that study area? Thank you.
Yeah, actually, foam model is very important to the sanitation sector. If you focus on my slide, then you can see that we have main 4 parameters like focus, opportunity, ability, and motivation. And I got lots of questions that integrated, what kind of people will we take? So here is the target population. So when we go for the Sanifoam model, then we can actually link with each other. So this is my first answer. And another one is actually depends. Like, will it be connected to each other, or biased or not biased, right? Yes. So I think it depends on the context, it depends on the objectives, it depends on the overall thing. Actually, you know very well that where you want to go. So, yes, that's it. Thank you.
Any other questions from the back? No? Thank you, Khadiza. I believe that this was quite an insightful reflection of how market-based sanitation solutions can provide, service delivery options at the rural level. Thank you. Overall, we have all reached the final presentation and the final presenter for this session. We have touched upon from the concepts of leadership, presented by Practical Action. We have noted how market-based solution can be done. We have had some very good presentation from the academia, from Jahangirnagar University, as well as from Dhaka Medical College, focusing on critical sanitation issues. And Esolve has also presented the Chattogram-based sanitation challenges that we are noting every day. And at the beginning, we had NGO Forum for Public Health, who also spoken about the transparency and the governance-related issues in public schools that can challenge the sanitation journey that we are having. Overall, I believe that there are a lot of knowledge that we have found in this room from different perspectives, from different angles, and this actually gives us hope. And at the same time, with the global geopolitical occurrences going around with donor funding, it also prompts us to think a little bit more critically how the financing could be done. Should we find a conduit of working with hardcore private sector? What would be their incentive to invest in sanitation? How would they get value out of it? These are some of the critical factors that we need to take into consideration for the next journey of safely managed sanitation as we move along. On that note, I would like to thank everyone for coming, for the questions, for the reflection, and for the wonderful presentations. Thank you.